Have you ever opened anti-amoebic drugs and felt like everything looks same? Nitroimidazoles, amides, antibiotics, and suddenly your brain just says, I will study later. But here is the truth. This topic is actually very simple if you learn it in the right way. In today's video, I am going to break this entire classification with few easy memory tricks, tissue drugs and luminal drugs. By the end of this video, you won't just remember it, you will be able to recall it in seconds during exams. So let's simplify anti-amoebic drugs in the pharma palette way. Anti-amoebic drugs are initially divided into two different subclasses. To remember the subclasses, remember it as anti-amoebic drugs LT or TL. T means it is the first class, which is tissue amoebicides. L means it is luminal amoebicides. So just remember it as TL. One is tissue amoebicides and luminal amoebicides. So coming to this tissue amoebicides are further divided into two subclasses. One is for intestinal and extra-intestinal amoebiasis, and the other class is for only extra-intestinal amoebiasis. So here, just remember the trick as NAIC, where N means it is nitroimidazole. A means it is alkaloid. K means remember it as quin. So you can remember the example, which is chloroquine. So chloroquine is the only drug that is given for the extra-intestinal amoebiasis. So coming back to the tricks under this nitroimidazoles, remember that these drugs will be ending with the term nidazole. And for alkaloids, remember it as DM. So you can also remember this as TM sauce. T means it is tinidazole. M means metronidazole. S means secnidazole. O means ornidazole. S means satronidazole. So coming back to the alkaloid, remember it as DM, where D means it is dihydroemetin. M means it is emetin. Emetin and dihydroemetin comes under this alkaloids. Chloroquine is used for extra-intestinal amoebiasis only. And for this luminal amoebicides, remember that these are divided into three different groups. And to remember all the three different groups, remember it as AHA, where A means it is amides, H means it is 8-hydroxyquinolines, and A means it is antibiotics. In amides, remember it as dilnita, and for 8-hydroxyquinoline, remember it as quin and iodo, and for antibiotics, remember it as 4-paro. So for this, by using these tricks, let's try to write the examples. So in the amides, dil means it is diloxanide, furoate. Nita means it is nitazoxanide. And for 8-hydroxyquinolones, quin means it is quin iodochlor. Iodo means it is iodoquinol. Antibiotics, 4-paro is the trick. 4 means it is tetracycline. Paro means it is paramomycin. So let me just repeat this entire classification for you once again. So the anti-amoebic drugs are divided into two subclasses, and to remember the subclasses, remember the trick as TL, where T means it is the first class, that is tissue amoebicides, and L means it is the second class, that is luminal amoebicides. In the tissue amoebicides, remember it as these are divided into two classes. One is only for extraintestinal amoebiasis, one is for both intestinal and extraintestinal amoebiasis. So here remember the trick as NAKE, where N means it is nitroimidazole, A means it is alkaloids, K means it is quin, which means chloroquine. And this nitroimidazoles, remember it as these will be ending with the term nidazole, or you can remember the trick as TM sauce, where T means it is tinidazole, M means metronidazole, S means secnidazole, O means ornidazole, S means satronidazole. So nidazole is the ending term. And for alkaloids, remember it as DM, where D means dihydroemetin, M means emetin. Emetin and dihydroemetin will be coming. And coming to the second class, that is luminal amoebicides, remember it as AHA to remember the subclasses, where A means it is amides, H means it is 8-hydroxyquinolines, and A means antibiotics. For this antibiotics, remember it as 4-paro, where 4 means it is tetracycline, paro means it is paramomycin. And for this 8-hydroxyquinolines, remember it as quin and iodo, where quin means it is quinido, quin iodochlor, iodo means it is iodoquinol. And for amides, remember it as dilnata, where dil means it is diloxanide furoate, nita means it is nitazoxanide. That's the complete classification. Now it fits with simple codes and tricks. This is exactly how you study the classifications, not by mugging, just by understanding and simplifying. If you can learn like this consistently, finishing the classifications won't feel stressful anymore. Comment done if this actually made sense, and share it with your friends who is still struggling. And don't stop here, because in the next video, I'm going to simplify another big topic just like this in minutes. So make sure you subscribe to Pharma Palette, and let's make pharma easy together. See you all in the next video, and thanks for watching.